Hey, Dr. Chopra, good to see you again.
Likewise, thank you.
So I had a few questions for you, especially because you're one of the early adopters of the Data 360 MCP. You joined us and gave us a lot of feedback during the developer preview. So first off, a huge thank you for helping shape where we are today and validate its effectiveness. Absolutely invaluable feedback. I hope not to just hear from you, but from anybody in the audience who adopts this. Easy to find, would love to hear from any of you. But with that, I want to ask, what does Data 360 Headless actually look like in your day-to-day practice at MIMIT Health? And how has moving away from traditional UIs transformed your team's operational efficiency?
Yes, it actually has been, beyond exponential, if you want to see, not just doubling. I had bet on getting all our data together in one platform years ago, and I struggled through many different architectures till I landed on Snowflake. Every data that we have from every possible EHR, engagement, et cetera, billing, revenue cycle, accounting, everything goes into Snowflake, zero copy into Data 360. So for us, this is not just getting marketing and clicks, and this is really having a digital twin of a patient. And now, and initially, we used to have data engineers and architects go and doing all this, and we used to wait. They were the bottleneck. Once we got the Data 360 MCP going and became headless, is spectacular. I mean, I can, through Slackbot, ask questions. I'm getting answers. I could give you hundreds of use cases. We already had 50 plus agents. We take our standard operating procedures. We ask the question, how can we do this better, faster, cheaper? Can an agent do this? And having that unified data in one place is spectacular. If you're my patient, I can ask a question. It goes into Data 360. It gives me a 360 on you, your meds. Did you miss an appointment? And now I can create segments. Earlier, I had to ask people to do it. The demo that showed that segment creation, in that case, I'd say, show me a patient who missed his last appointment, whose blood sugar was high and needs to be seen. And that segment is created. Then we work with Claude extensively. Claude's kind of the brain. Slack is the face. And obviously Salesforce is the infrastructure, and all the data is in Data 360. This has been just beyond exceptional for us.
Outstanding. I mean, in our conversation before we started recording, I think you mentioned turning a full day of administrative work into something like less than an hour.
Oh, I can give you a bunch of examples. One is for example, right after this, I have 6 surgeries to do. In Slackbot, I ask the question, show me my calendar, tell me who's on, give me a 360 on each patient, show me the last medical information, what are the gaps, have they met all the guidelines, do I need anything else to do? I can, in Slackbot, say, and each patient has their own channel. I'll say, create the update, create the 360 for me, create the last guidelines that we have, create a canvas, and share it with the team. And another example is, we used to, when patient comes to us, we bill. That's a billing software. When the insurance company pays us, it goes into the bank, and there's a separate accounting software. So now this used to be a nightmare. So if a patient bill was paid, the person had to go into the billing software and see, oh, there's a document, an ERA that says payment came in. He had to call somebody or send a message to say, did this check get deposited? He would then confirm, post it in the billing software, and maybe 2-3 days later, if it happened, the accounting team got it that, oh, this money was paid. That is down, which used to be cumulative about 4 hours, is down to 3 minutes or less. Where what happens is all this data is in Data 360, our accounting, our patient care, our ERP, everything is in Data 360 on the platform. We have a skill and an agent that's set up. We call it a reconciliation agent. And when invoked, it goes, it looks at all the new ones that came in, and it looks at every patient, checks the bank accounts that it got deposited, looks at the patient record that this encounter did happen, and updates it. So 3 hours to 3 minutes, you can see the scale.
Amazing. So from our previous interactions, I know how much you put people first, how that's a cornerstone of the way that you run your business. And one of the things that sticks out to me is that healthcare is an industry where mistakes are especially painful. And we can't deny that AI has some level of hallucination inherent in its use. So I wanted to ask, what's your strategy around maximizing trust, minimizing hallucinations, and ensuring that consistent quality of patient experience that's so important to you?
Yeah, I'd like to start by saying, when we say hallucination, now these days we talk mainly about AI having hallucinations. Humans have hallucinations too. See, we are gifted with imagination and memory. If that imagination goes beyond a certain control, we say it's hallucinating. A human being is hallucinating. LLMs were designed to predict the next step. So they're great guessers with massive cognitive capabilities. If it goes beyond what we know as context, it becomes hallucination. So I teach my team, listen, LLMs are like take the world's best, Nobel laureates, put them all together. They have all the knowledge, but all they can do is talk to you. Now, if I go up to them and say, tell me about my medical condition, they don't know me. So the first thing is to give the right context. The second thing is we give it strong guardrails. The rule is this: if somebody's going to lose a job for an action you've done wrong, they lose a body part, or somebody's going to die, agent can't do that. If it's a simple 1+1 thing, move this from here to there, agent can do it, but there's always a human in the loop. So in every one of these transactions, like I said, when it comes to a patient record, now we're looking at medications, labs, diagnoses. We put together the EHR care plans. We get it to look at external, standards and give us an output. But a human is always in the loop. That is the most important thing.
Awesome. You mentioned the patient digital twin concept.
Yes.
I know you've talked a lot about ontology in other conversations we've had. Is there something about that you think is really important to share with our audience today?
Absolutely. See, ontology means the study of things as they are. Aristotle came up with this. This is a long time ago. Now that we've come down to computers running our lives for a long time, we had to go by what a programmer did. Said, hey, this is the sequence, these are the conditions, do this. There was a schema, and you had to follow it. So for 30 years, I've been putting stuff in EMRs, following a schema that didn't make sense for the patient. Now comes, what should life really be like? A patient's a patient, an appointment's an appointment. These are entities, they're relationships. So we created what real life should be like, and I've been working with Salesforce and now how to bring those ontologies into Data 360. But what we've done here is an agent will go look at the ontology and say, you cannot go outside of this framework. You absolutely look at it and say, this is what it should be. Yes, here a patient is PAT, here's PT, here's another name, doesn't matter. It still is a patient. So the ontology makes the agent really work well. So that's your context and semantic layer. Without that, it is all just noise. That's really the most important thing. And that's our moat. We say that the entire Salesforce ecosystem that we built, we call it the IHOS, Intelligent Healthcare Operating System. And that is on the data foundation, the Data 360 Foundation, where we've taken everything that, see, I'm in the business of helping human beings lead their best lives. If I don't know you and everything else about you, how am I going to help you do that? So your allergies, your labs, everything. For unstructured data, we put it all in Box, and we have Box agents as well working. All of this also gets vectorized, and parts of this comes into Data 360. But our agents through MCPs will talk to Data 360, talk to Box as well, put it all together, but looks at the ontology as well. And now I can give you personalized care with this agent doing all this cognitive function for me rapidly.
Outstanding. I have one last big question that might lead into a couple of follow-ups.
Sure.
A lot of organizations are struggling to get real ROI from agents right now. It's something we see headlines in the news about all the time. There's lots of new studies. How do you distinguish between a basic digital transformation and the kind of outcome transformation that you've walked us through that you did at MIMIT Health?
Yes. So, see, when you have mice at home, you're not looking for the fanciest mousetrap. All you want to do is get rid of mice. And with that, what happens is everybody's out there looking, I want to build agents. versus asking the question, what problem is it that I need to solve? So first thing we did was understand your underlying processes, and a system produces an output. That was number one. Number two is, see, these agents, which are LLMs, which have taken a large amount of human knowledge. It has been given the ability to reason by really being very good at guessing. But when they are without context, they land up guessing and causing more and more problems. So if all your data is not in one place, so that was our simple reason for success in this has been Data 360. Now, when Data 360 was CDP before, and it was all marketing functions, and we were doing this, but in healthcare, that was not the core thing for me. Including marketing for us is not clicks, it is care. If you get a message, Chris, from me, if you're my patient and whatever condition it may be, if you get a message from me, we want it to be trusted. We want you to be educated. But for that, I need to know you. And I need to know everything about you. So that becomes what I call the digital twin. With that information in Data 360, now I can have the agents really work very well and now bring out that outcome transformation. And what outcome do we want as human beings? We want to live as long as possible and have a great life and not have to kind of sell your house and go all over the place just trying to get care. I could go on about this because this is really so close to me. And I'm stunned and surprised as when I talk to large organizations sometimes, and they're still struggling with this. But Data 360, once we put that together, and your MCP changed it. Now we have MCPs with Notion, we got it with Box, we got it with just about anything we can, our Salesforce orgs and stuff. And just about every day, because we have all the data in one place, I am solving problems so fast, it's not funny. I have about 200 people doing the work of maybe 500 or 600 right now, and we're just scaling this up every day.
Outstanding. So it all comes down to that, putting the patient first, focusing on solving the problem that's immediately in front of you. As cool as the technology is, setting aside the cool technology and focusing on the real business problems. So it's a trusted context layer, that ontology, and that relentless obsession on patient care that brings it all together for you, it sounds like.
Absolutely. It's, customer obsession is the first thing. And that's one of the reasons I get along so well with Salesforce. I've been in the ecosystem for 13 plus years. And we are wall-to-wall Salesforce minus Revenue Cloud. I've got everything tied in together, and everything external, whether it's external data, all through Snowflake, zero copy. This has been a massive game changer for us. I mean, we have, like I said, exponential growth. This is not just like you grew. We were growing 20, 30% a year. Now that this has come in, it's upticking fast. And we can't just seem to get enough of it. And when with this MCP tools that you've created with Slackbot, oh my God, Claude, Slackbot, Data 360, and on top of that, you've got all the agents running. It is fantastic.
Awesome. Well, we have more tools coming, so I can't wait to see how the continued expansion of the MCP server and Data 360's API surface helps you accomplish more. It's always a pleasure, Dr. Chopra. Thanks for joining and sharing your story. It's always just so much fun to hear from you on the novel ways that you're adopting things. And again, thank you so much for your feedback during the developer preview and being an early adopter. It's been personally invaluable to me. So
absolute
a personal
pleasure.
thank you.
Thank you. Thank you too.